60-year-old man presents with shortness of breath that started a year ago, exacerbated by physical activity. He has been working in glass manufacturing industry for 30 years. His vital signs include a heart rate of 72 per minute, respiratory rate of 30, and blood pressure of 130 by 80. On physical examination, there are decreased breath sounds on both sides. Chest X-ray shows interstitial fibrosis with reticulonodular infiltrate on both sides and eggshell calcification. Which of the following is most likely diagnosis? Berylliosis, silicosis, asbestosis, talcosis, and byssinosis. So basically, what they tried to put in the question is this patient had a history of shortness of breath. He worked in glass manufacturing industry. Silica is usually used in glass manufacturing, and the silicosis is therefore common in glass manufacturing. People who are working in glass manufacturing. He had all infiltrate, interstitial fibrosis, blah blah blah. An important point, as I told you, is eggshell calcification. So once there is eggshell calcification, it is more likely to point towards silicosis. Another important point to remember about silicosis, as I told, is it can increase the chances of TB. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.